You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, nobody should be wearing a loose-fitting denture. We're talking about dental implants today. With us, we have Dr. Gerry Catapano. Dr. Catapano, welcome to the program.
Thank you, Randy. Nice to be here.
Now, for people that don't know your practice, and I know you brought some photos, so we'll get to as many of those as possible, and you're a general dentist, but for people that don't know your practice, who's the typical patient that's coming in for dental implants?
Well, we have two types, actually. We have the ones that come in that have their existing dentures, and no matter what we do for them, they just can't get happy. They just, especially the lower ones in particular, they just flop around. They've been to great denturists in the area, and they just simply can't get it right. So they come to me to have a solution that can snap in or snap out with their dentures. They're coming to me, they want a new set of teeth. They want them secure because they're always flopping around. They can't chew things. They're just rubbing things together with their teeth. They want a more secure solution, either snap in, snap out teeth, or permanent teeth that stay there, and they can eat pretty much whatever they like.
Now, what about the people, though, that have bad gums, the bleeding gums, the gum disease?
Yes.
This crowd, are their gums too bad to do this?
Oh, no, they're not bad. They're not too bad to do this. We can take care of that, but we just simply have to, I mean, they get to a stage where their teeth are basically finished. They're hopeless teeth, we call them. And then we get them out of there, we let everything heal up, or if the conditions are right, we can place the implants in the very same day. And they leave with teeth at the end of that day.
Is that right?
Yeah.
So now the denture wearers, because we said at the top, no more dentures. Are there a lot of people where you are with dentures?
Yeah, there's quite a few actually. Gosh, at least 10% of the population. In my area alone, in fact, if you look at the Rogers Center, you could fill that up with a lineup to spare, just in our area alone. Or
like tens of thousands of people.
Tens of thousands.
With an upper lower denture.
Upper lower denture, oh yes. And then of course, if you take the Scotia Arena, where the home of the Maple Leafs and the Raptors, you could fill that up 2.5 times quite easily. Again, just in our area, but about 10% of the population.
So a lot of denture wearers.
Oh yeah, at least, yeah, over 1 million.
Well, if dental implants are so good, why aren't they all doing it? Why aren't all these denture wearers coming in to get a brand new set of teeth?
Well, I'll tell you, Randy, there's a few reasons for that. My take on that is this, that when they have, if you look at the denture wearer, they've gone through problems over and over, back and forth to the dentist, just going through patchwork and infections and this and that, extractions, always fixing things back and forth in pain. And for them, when they remove all the teeth, for them, it's like the end of the road. They finally get relief. They can go away, no more dentist, no more hassle.
No more expense.
No more expense, oh yes, yeah. However, that's a bit misguided because over time, they're gonna find they've just got these pieces of plastic in there and they can't chew the food that they like, the foods they used to like. So that's what we do. We try to get them back to that, to enjoy what they've had, and not to mention their nice smile too.
So a lot of people go to you also because they feel like they're headed to dentures.
Yes, and they want to avoid that. They've had their teeth as long as they possibly can. It's amazing the sort of people that what the human condition can tolerate and adapt to. One guy's had just a couple of front teeth, a few back ones, and he's been living like that for years. I don't know how he does it, but he comes to me because he's finally had enough and he wants to get a smile back. And he's out there in the community. He's a real estate agent, and I don't know. Really, I mean, perhaps he doesn't smile much, but he still sells homes. He's quite successful at it, but I don't know how he does it. He comes to me asking for a solution to his spaces and getting his teeth back together, getting his smile back to looking good and being able to eat things, because he just tolerates. It's if he tolerates whatever his diet is, and he's lived with that. He's adapted to it, but now he wants something better, and that's where we like to help them. Okay, his options were never to have dentures. He just doesn't want them anymore. In fact, he doesn't even wear the ones he currently has. These partials of his. So we looked at them. We took this 3D image that we do for all our patients to make sure there's enough room, enough bone to place these implants. So he just didn't have enough bone on the sides of. In fact, his bones did shrink, so you could see the cheeks going in. So the first step was to make enough room. So we went through that with him, and now he's at stage 1, where it was interesting because after the procedure, he actually looked younger. He looked a good 5 or 10 years younger, and it wasn't for me. My own staff was saying, "Wow, You look great. I even went to him and I said, God, I should do surgery on you more often because you look terrific. But that was, of course, just after. Now that things have settled in, he still looks good. He looks fuller. He looks more youthful. And that's before we haven't even put in implants in yet. So we're looking forward to that next step. So back to your original question of why these patients don't come in to get treatment done. They feel like they're out of the system now that their teeth are gone and their problems are over. And they don't know any better because they don't know the options. They haven't been presented to them.
Good point, okay.
Yeah, and we're there for that, for them, to inform them on the options that are there. You no longer have to live with pieces of plastic in your mouth. You can actually have them snapped in quite nicely and a lot smaller too, so you can expose the palate, and you can taste things better, and you can function better, you can speak better, and with more confidence that things aren't going to loosen, say during a tennis game if you're into that, or swimming, or a number of activities.
How old can you be to do this?
There's no upper limit as long as they have the health, and even with that we can work with almost most patients really, as long as they can walk into our center and I can and they're asking the questions. Then it's all doable. We can help them. We go through.
What's your oldest patient that got dental implants?
95.
Why would a 95-year-old want to do this?
Well, geez, Randy, they want to chew just like, well, there's a few good reasons. They want to chew just like you and me. And we take it for granted, but for them, they lost something in their lives. They want to get it back. They want a nicer smile. That self-esteem is still there. I mean, this man was incredibly successful with his life, and he's now enjoying his retirement with his lovely wife, and he wants to proceed and start eating and just doing the everyday things that he would enjoy with his smile and getting out there. And we placed a few implants in him, selective implants, so he can eat better and chew. There's no spaces left. He's got a full smile now, and he's very happy.
And most of these people, I guess, are sedated, like oral sedation.
Yes, we do. It's great for them. I mean, they're typically a little nervous of the unknown, even big or small procedures. That we'll give them a pill, we'll watch them for an hour, or they'll come in. We have the specialist come in that puts an IV in, and before they know it, no matter what length of time, I recall this 4-hour procedure, they woke up and realized, God, we're already done. And I come in, of course, and see how they're doing it. It's just terrific for them. They don't even realize the timeline that's been there. Another reason why a lot of people aren't doing this is because of cost. I mean, they count their teeth and they figure they need an implant for every one of their teeth, which is not true. We can actually do a full set of teeth, a good upper and lower for 4 to 5 implants, and then that actually locks in your teeth, so you don't need that much. And we also offer financing, which also helps them.
Are people financing this?
Oh yes, oh yes.
Because insurance. Now we should mention, even here in the U.S., insurance doesn't cover dental implants.
Yes.
Same as Canada.
Same as Canada, yeah. Although that's changing. We have seen some changes from time to time. It's been a hit and miss right now, but I think they're getting more on board. And they do often cover it at the expense of other alternatives. So we try to work.
They'll cover small parts.
Small parts of it, yeah.
So at your office, you will maximize their insurance.
We will maximize it. We will do the estimates for them. We will help them as much as we can. And we offer financing for the part that's not covered.
Now, these are for people that, like, you're not carrying the financing. It's a lender. So you have
to
have decent credit.
Yeah, decent credit. And we also offer within a small period of time, we also try to help them with certain monthly things. Within a few months, we can help them with. Beyond that, yes, we have lenders to help them with that.
Okay, now you brought some photos. What are we looking at here?
Well, we're looking at this fellow. He's a good patient of mine. He came in, truck driver fellow, and I didn't think he actually had any teeth when he first smiled at me, and if you want to call it a smile. But when I met him and I was listening to him for the first time, quite frankly, I thought he was drunk. He spoke eloquently, he spoke perfectly, but it wasn't. But it turns out that it wasn't that at all.
Like he was slurring.
He was slurring. And I thought, well, okay. But it turns out that he couldn't speak very well without his teeth, and most of his teeth were there, but they were just down to the gum line. They were diseased, they were broken down, splayed out, and he just had a hard time actually speaking. And so that was something that he had to endure that, and he tolerated that for years. So he came to me and said he's had enough, he wants to do something about it. Nicest guy. So I just got one before and after photo here. So this is his before, and we actually had to get him to smile that big. And
so that's his smile?
That's his smile as well as we know it, and we're not too sure if that's his full smile, but we had to work on that to get him to do that. So the first order of business is we had to get him teeth again because I couldn't even tell that he had teeth there. So we gave him some teeth. We removed his existing
Take a look
teeth.
at that.
And this is just the first step. So he's got a smile back. And as you can tell, he almost seems like a forced smile. He may not have even been used to smiling over all these years. So, and then this is this one where I actually cracked a joke and got him to laugh a little. Okay. And I think that might be close to what his smile is like. But again, we're just starting the journey with him, and he's thrilled. In fact, he goes to me, he says, Doc, I should have done this a long time ago. And he was dreadfully afraid of dentists. He just did not like us. In fact, one of the first things he said, because of all this painful journey I was talking about earlier, going in from one infection to another and never really getting ahead in any way. It was always patchwork here and there. So it was over years and years, and he just finally gave up and dealt with what he had, but now we can help him.
Now, do you think this is the future of dentistry, where dentures, you have a denturist there, but dentures as we know them today, maybe in 40 years, how long it's going to take, they'll all be attached to something?
I believe
like
so.
Like implants?
Oh, absolutely.
When you talk to denturists, do they feel the same way?
Oh, yeah. And there's such well-qualified denturists out there, a few in my own town. And my goodness, they could do the best job on the planet and still they can't get the results because they're still not attached to anything. They're just floating around there.
It's hard to chew.
It's hard to chew. And things move when you chew. There's
I know a
nothing
couple of denture wearers. They never complain.
Well, sure, Randy.
You saying there's no such thing as a happy denture wearer?
Hang on. They're not going to complain to you, Randy. They're going to complain to me. I'm the dentist. Okay. It's not every day you're going to have a dinner with a buddy and say, oh, by the way, I hate my dentures. But no, they come to me and they tell me the same story. 99% of them are on the bottom. The top, when they lose the suction, they're just so embarrassed. In fact, they go into restaurants. They got to watch everything they do. It's like they're always, well, for example, they're out doing something with friends and then they want to go to a restaurant and go eat. They have to think twice about that because they wonder what they have to choose on the menu. Some of them don't even want to face that sort of potential problem of food getting stuck, the dentures getting dislodged. So they just make up excuses. Got to go walk the dog, wake up early in the morning, and it stifles their life. It actually holds them back. And it's a sad thing to see. And so they're wearing their dentures and they come to me and they say these things are just moving around. And you get nips and pieces of their life, which is really quite sad, actually, because they're limited in so many ways. They're limited in their social life. They can't chew properly. They're rubbing their teeth together. That's not really chewing. It's unless you're a cow. But then they're going in there and they're trying to munch on different things. And the doctor might say you're not having enough fiber, for example. We do get a lot of that, especially with our elderly patients. And they're saying to themselves, well, good luck with that. I mean, how can that be possible? Because they can't chew these things. So they take the Metamucil, lots of Metamucil, and that can upset your stomach. So things like that can happen. So
what do they like most? Do they like the chewing part of their brand new teeth with dental implants? Or do they like the look of their new teeth?
Oh, that's a good question. Both is the best way to answer that. You got the ones that want to come in and want that smile, and there's others that want to come in and just want to chew better. But what's interesting is what happens is once this is done and we give them that great set of teeth, there's a side effect. They come in and they got the ones that want the smile realize, hey, I can chew again. I can chew into things like carrots, and I can bite an apple. I can have that juicy steak.
Even with the front teeth, they could bite into things?
They can. Yeah, it depends on the system we put with them. That more permanent option, absolutely. The snap-ins, yes, as well. It depends how many, but the system does allow for a great improvement of the type of foods they can have.
So for those people, by the way, they have bad teeth, you cannot save them. Full mouth of extractions. Yes. What are their options in your office with dental implants? And then the denture wearers. What are their options? So take me through that.
All right. Well, let's start with the teeth, the people with the denture wearers. And they're usually very loose fitting. So we want to improve their situations. So for them, it's actually quite easy. We can start with 2 implants on the bottom, say. You have to have minimum 4 on top, but that's just because of the science that we've discovered that 2 just doesn't work up there. But the 2 on the bottom is a heck of a lot better than what they've got because it's floating around.
And then just what? Just snaps in, snaps out?
Snaps in and snaps out.
No more adhesive?
No more adhesives.
Okay.
And that's another topic entirely, but no more adhesives. They just snap them in, snap them, and they're thrilled. But what tends to happen, I already know from the beginning, there's going to be a little lift in the back. I mean, it's just supported there, but it's a heck of a lot better. And then they come to me. over time, and they'll say, look, I think it's time to get a little more retention here because I'm enjoying the foods, but there's still some that I want to enjoy more, like the more harder consistencies and whatnot. So we can upgrade to 4 of them, or we can add another 2 where it clips in and it's actually much more stable, twice as stable.
So it's just kind of locked in.
Locked in a little bit better, a lot better actually. On the top, when you put 4 in, it's just great because it's right off the top, it's done there. But the advantage of the top ones for denture wearers is that we get rid of the palate.
Okay.
So in a complete upper plate and upper dentures, you got to get the suction, so you need the palate to get that suction. But in this, you can get rid of the palate because it's all clipped in now, and they can taste again. I mean, they actually taste foods, taste temperatures, taste spices. It's just a dramatic improvement in what we can do for them. Now, in terms of the people with teeth, well, they're used to having something hard in their mouth. So for them to just give them 2 snap-in dentures, that might be a bit of a step back. So I often encourage them, if possible, if the imaging allows for it, we encourage them a more permanent solution where we can actually screw in these teeth. They're permanent teeth. They're there. Their smile's there, and they're there. And only I can take them out every now and then for maintenance.
So with as little as like 4 or 5 implants, you could give them a brand new set of teeth that don't even come out anymore.
That's exactly right.
And they just what? How do you clean those?
Well, just like your regular teeth, they got the water picks, or there's the air flosses, water devices. You can go underneath with all sorts of the things you use for your natural teeth, you can use for your implants.
And then checkups like every 6 months, same thing?
Every 6 months, it's the same thing. We encourage more frequent cleanings, really, because we just want to make sure that the foundation's happy and solid and healthy.
So no more dentures?
No more dentures, just solid teeth, being able to chew into things.
And denturists are sending you patients.
They sure are. It's great where they're going. They're now seem to be advancing and evolving into snap-on, snap-off dentures, and that's why I alluded to your previous question, that even 20, 30, for years from now, I don't think we're going to be seeing the ones that just fit in or sit on top of things. Sit on top of your gums.
They'll all be attached.
They'll all be attached. Yeah, that's where I see this going.
Now you'll work with, because if somebody's been to an oral surgeon or a periodontist or prosthetist, whatever, I mean, you'll work with the specialist.
Absolutely. There's some terrific ones I've learned a great deal from, privileged in fact to be working with them, and those would be on special cases that I feel I need a little help on, quite frankly, and they're there to help, and we work as a team. It's a close-knit community.
So they could walk in, I mean, if everything works out,
yeah.
on the day of the procedure, no teeth, walk out with teeth.
That's right. That's right.
Does that ever happen?
It does happen, and it's quite remarkable the kind of responses that can happen too. They're quite emotional ones at times.
Is that right?
Because when they get out of the sedation, we show them in that mirror. We had this one guy, and when he sort of came out of his sedation, and he was able to chat with him, we gave him that mirror. He saw his lower teeth for the first time, because there were barely any to begin with at the beginning of that day. They were locked in, and you could see his eyes well up, and it was really something. And there was a moment there that we just let him have.
Do you ever get choked up?
Oh,
yeah. Your assistants get choked up?
Oh gosh, it's something. Just to see how they change. It's like an evolution in such a short period of time, and not even that day. But when they come in a little later, when they pop into my office on their checkups, how their demeanor, the way they carry themselves, it's just all like they're glowing. It's a remarkable thing to see. It's like their inner self or their inner smile comes through.
Nice.
Yeah, it's really dramatic. It's sometimes, and yeah, it gets to you. And that's why we keep doing it. That's probably the most gratifying part of my job.
So because you do a lot of stuff. I mean, I know you do root canals, you do wisdom teeth, you do a lot of things, right?
Yeah. Uh-huh.
But is this the happiest group of patients? I mean, you take somebody with no teeth or wearing a denture or really bad teeth, and then give them a brand new set of teeth.
This is
like they want to hug you or something.
Oh gosh! Oh yeah, I'm a hugger by nature, and we do hug a lot. They just get out of that chair and they just hug us all and thank us all, and it's gratifying for us and of course for our patients.
How soon can they eat? Okay, so you did the procedure, everything went well.
Yeah, they can eat right away, but for the first little while during the healing phase, they got to be careful. They got to still watch what they're eating.
Take it easy.
Take it easy. Softer foods. Let everything integrate. Let everything lock in. But before you know it, they're able to chew into most things that they haven't chewed for in a long, long time.
Is it more women doing this or more men doing this?
It's a pretty even cross section, I'd say. Pretty even number, men and women.
What's like the big thing they want to eat?
Oh gosh, it's different for everyone. There's those that want to eat their nuts again, certain types of nuts, I guess. There's others
So
that
you can eat nuts with this?
you can eat nuts with this.
All right.
You can eat nuts, certain types, because there's rock hard ones. We don't want that. But most nuts, yes, absolutely. Then there's people who just want to bite into an apple. Apple season. They just love grabbing it from a tree. This one lady that goes to apple picking, she'd like to be able to eat it right off the tree, but now she doesn't. So, and then there's oh gosh.
Like chewy things? Could they eat like a pizza?
They can have a pizza.
Or like a sandwich, pull it out of their mouth?
Oh, yes. Oh, yes. Oh, yes. It's really remarkable stuff, what they can do. I had this other patient, interesting guy. He just didn't have upper teeth when I saw him. And I said, do you have a denture? He said, oh, yeah, I've been through so many of those. I went to everybody that I could think of, and it wouldn't stay in my mouth. It kept falling out. So I just didn't bother wearing them. So he managed to live without upper teeth for who knows how many years, several years.
Okay.
And he's a truck driver. He travels long distances, so most of the snacks are either chewy or crunchy, and he couldn't have any of that. He'd have to pack things and whatever. So we helped him. We gave him 4 implants. We gave him a snap-in, snap-out denture, gave him his teeth back. We made it nice and small, and my God, now he's able to chew again, and he enjoys those snacks on his long trips. He comes in whenever we call him. It's just interesting the way he's changed. He's just transformed his life, really. He's just a happier guy.
You say you can tell a difference. That means once you give them a brand new set of teeth, it's like they come in, they're different.
They are
Elaborate
different.
on that.
Well, they come in and you can just tell that they're more chit-chatty, more positive, more smiley. They're actually proud to be there to show off their teeth. They come to us and they check it out. Look at that, it's looking great. And a lot of times they actually look better. They've either lost weight, or in this guy's case, he actually gained weight. He says, now I got a new problem, Doc. I got to lose weight from all the food I'm eating. So we thought that was kind of funny. But they just more well groomed. They look better. They want to take better care of themselves. I mean, they're more engaged.
Okay.
Yeah.
Now, we were talking about in the green room earlier about Hollywood, that people with bad teeth are judged.
Yes. Well, if you look at the way Hollywood portrays a poor person, they make their teeth look ugly or dirty or badly decayed or just dark. And that's considered a poor person. You want someone to look dumb, get rid of your front tooth. And then they look dumb.
This is what they do.
This is what they do in Hollywood, yeah. And so it's very important, this smile. I mean, heck, 95% of us are fully covered all the time, and there's a smile right there in the center of your face, just for all to see. So yeah, it's
now
super
you're
important.
a dentist, of course. You probably think that the smile is like the most important thing.
Well, sure, Randy, of course, but don't listen to me. There's surveys out there from all around, from Cosmopolitan, Men's Fitness, Women's Daily. Every survey that's been out there, when they asked, what's the most attractive thing for your mate? What do you look for? And now, the smile is either number 1 or always in the top 3.
That's true.
And that's pretty remarkable stuff. So I guess, these surveys don't lie. And that's pretty important. So don't take my word for it, but, I get it firsthand. And I'm lucky to be part of getting those smiles back. So let me give you a really good example of how important teeth are. You take 2 identical twins going for a job interview, both have master's degrees, and they're sitting there, and one of them doesn't like their smile, and the other one couldn't care less. They're both nice smiles, but one's concerned or self-conscious about their smile. So at the interview, one's not going to smile. They're going to try to cover it and hold back. The other one just is herself and not smiling. You got to ask yourself, which one are they going to hire? Well, they're not going to hire someone just because they smile more, but it exudes confidence. That's
a good point. Yeah.
Gets them happy, and they're just more positive. And those are the people that would get hired. So there you go. That's another good point to smiling.
It's like you say. It's like you said earlier that in life, if you don't like something about yourself, it holds you back.
Yes.
So if you don't like your smile,
it holds you back. Yeah, and it's a sad thing to see in some people because you want to help, you can help them, and you see them walking the streets. They look either grumpy or.
So you can spot it as a dentist, that they're hiding something under there.
Yeah, I mean, I certainly don't have X-ray vision, Randy, but I can tell you that I see them, and I do wonder, could they be the ones that are holding back because of something that they're not happy about? Could be their nose. Like, take my nose, for example. It's a pretty big nose. I really don't care about it, but if I walk into a room, I'd be self-conscious about it, or I tend to have a droopy eyelid eyelid that comes once in a while.
Okay.
In fact, I even asked you about it earlier on. But I'm self-conscious of it. Nobody cares that they see it or not. They probably won't even notice it. But because of that, it can limit the way you...
So if you don't like your smile, do something about it.
Do something about it. Do something
Now,
about
if you're
it.
worried, like a lot of these people, like you said, they think they're headed for dentures.
Yeah.
Like they think there's, and they put it off, and they put it off, and they put it off.
Yes. They just don't want to accept the inevitable, or so they think is the inevitable. But they need the options.
But now they
explained
can
to
get
them.
new teeth.
Now, with today's technology and the imaging technology in particular, these 3D images, you can be so precise of what you place, and then decide and actually bring the implants down to a bare minimum that can, like I said earlier, 4 or 5 implants can support a whole upper
Now,
arch.
another thing about your practice, and people need to know, I'm not endorsing you, I'm just asking the questions, but how implants are normally done is you go to one place that does the surgery, another place where they put the teeth on top.
Yes.
You do it all in one place. You do both parts.
I do.
So aside from convenience, what's the benefit?
Convenience is a huge thing, Randy. Can you imagine all the scheduling changes they have to go around? People are busy. They get to come to one place, get it done, and know that the same person is actually following you from start to finish. And it's not only the convenience, but the continuity. So not to suggest having a team approach.
You work with oral surgeons.
Oh, absolutely.
And
No,
periodontists.
I do both, really. But there's the convenience, and they both work very, very well. It minimizes the steps.
Now, because there's only one person involved, it can be less expensive.
Yeah, obviously, Randy, when it's one person, the process can be more streamlined, and that can reduce the fees as well. Absolutely.
Okay, so no more dentures. You're going to wipe them out someday.
One day,
in Canada.
I'm on a mission. I might get a cape on one day, but no, I believe that's where our profession's going. Absolutely.
Now, we are really short on time, probably about a minute left, but somebody watching this, either they need a full mouth of extractions, and they don't want dentures,
Okay.
or the denture wear. How soon before they could get their teeth? They're watching this.
Well, if all goes
Next month?
Yeah. Yes, next month we could have them come in. They could leave with teeth that are locked right in, and 1 month would be about right if everything goes
right?
well. Yeah, absolutely.
It's just a challenge getting them in. Now, you do free consultations where you are.
Sure do. Yes, we sure do. We insist on it. I think it's important to come in and ask it because it's a big event. We want to make sure that they're well informed and have all the information with them. We give them a nice little folder that they go home with the most common questions answered.
Now, we're out of time. But we should mention, your brother is also a dentist.
Yes, he is.
That could be confusing.
It could be, but
Do they call you Dr. Gerry, or what do they call you?
they can call me Dr. Gerry. He's the Dr. Frank, and we're both highly qualified to do the same thing.
But you have practices together.
We
is that
do.
right?
We do. Yeah, we keep it in the family.
Okay. Are you more focused on the implants?
We both are actually. We
that
both are.
right?
Yeah, we actually discuss and work on a lot of cases together. The bigger ones.
Okay, good. Final message, somebody watching this, and for whatever reason, they're either afraid, skeptical, whatever, because nobody likes going to the dentist. What do you
course.
say? Denture wear, or they're headed for dentures? What do you say to them?
Come on in. We'd like to meet you. We can answer some of your questions. If it's just for a meet and greet, we just want you to come on in and ask the questions and just understand your options, and we'll take it from there. With so many ways to make it so much easier today.
I want to thank you for coming to the show. Good stuff.
Thank you, Randy.
Now, all of the photos, more information, they go to your website. They can make an appointment?
Yes.
Through the
they
website
can.
as
Yes,
well,
they can.
or call?
Absolutely. Calling as well, sure.
Do they get to see you on the consult?
They certainly will. If they want me to be there, I'll be there for them. I can't wait. I'll be happy
good.
to meet them.
Thanks again.
Thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.